At mVacciNation, our vision is to create productive societies. And trust me, the race for vaccination is on. Governments, healthcare practitioners are troubled with how to make day-to-day administrative decisions decisively and efficiently and effectively to be able to make sure that their complex COVID-19 vaccination programs reach everyone that's possible. mVacciNation is a cloud-based digital toolkit that supports day-to-day administrative decision-making for healthcare givers who are saddled with the responsibility of rolling out immunization vaccination programs for COVID-19. Eventual beneficiaries are people like you and me. We who are trying to get vaccinated and who want to be able to return to our normal lives as we still struggle to figure out what's going on in this new or the next normal. So we want to be able to become more productive as active participants in society. And we want to be able to galvanize and stimulate our economies back for growth and eventual overall acceleration, which is the path and trajectory we really were on before the COVID-19 pandemic showed up. So let's take a look at the two components of mVacciNation. The first component, which has to do with the stock visibility. What it does is it allows the ministries and the departments of health to have full visibility and control by registering all the vaccines, the quantities, the types in specific locations. It allows the ministries to ensure that there is no stockout effects out there when the beneficiaries arrive at the locations for vaccination. On the other hand, we then have the beneficiary management component. What this does is it allows beneficiaries who are willing to be vaccinated to be registered on the platform and to also be matched based on prioritization lists and also assign them with vouchers which they can redeem on the day of vaccination appointments. Once vaccinated, they then can be automatically rescheduled for follow-up dates should there be a need for a second dose of the vaccination, for example. Once that process is completed, you then get issued with a digital certificate, which you can also link back to national government initiatives for things like digital passports for international travel as well. And through this digitalized process, we're able to link the beneficiaries, we're able to link the healthcare providers, we're able to link the service providers as well in a full ecosystem and balanced demand and supply. All this fully visible on a dashboard to the Ministry of Healthcare. It does this by having trust inherently designed into the system. It is built on an open architecture. We are compliant with very strict security policies like GDPR and POPI of South Africa. It is open architecture and it provides real-time visibility end-to-end across the entire value chain for those who administer public health care and vaccinations. Think about third-party integration into systems that provide compliance, that provide pharmacovigilance, that provide things like cold chain integration, where you can actually monitor the temperature and the conditions of these vaccines. Imagine this end-to-end view being presented to a healthcare administrator. It is powerful. This is what mVacciNation brings to the table. Starting from South Africa, where a recent vaccination of COVID-19 events have taken place, we've had over 140,000 registered healthcare givers vaccinated and registered on this platform in the very first week of the vaccination. If you go beyond South Africa into Africa, over 1.3 million events of vaccinations have also taken place, where we've been able to register 260,000 in countries like Mozambique, like Tanzania, and like Nigeria as well. And we're ensuring that no one gets left behind. It is fully inclusive. It also supports the African Union's Free Continental Trade Agreement, which advocates for the free movement of citizens across borders and commerce to make Africa once again a global productive giant. Thank you.